Okay, thank you for tuning in. Welcome to this evening's webinar. The topic is on mental health and wellbeing, which is brought to you by Cambridgeshire County Council. I'm Jeremy Lloyd, the Director of Learning at Huntingdon Regional College, and the infrastructure for this webinar has been supported and provided by our Level 3 IT students, so thank you very much to them. I'm joined this evening by Claire Harris. Claire, good evening.
Good evening. Thank you, Jeremy.
Would you like to introduce yourself?
I will, yes. I'm Claire Harris. I'm the Mental Health Promotion Lead at Cambridgeshire County Council and I work in the Public Health Department. I'm really excited to be here this evening to talk to you about mental health and wellbeing. Generally as a population, we're really good at understanding our physical health. We know how to look after ourselves and we know how to get better if we've been unwell. We're less good with our mental health. But there are lots of things that we can do to promote and protect our mental health, and this evening we'll be talking about that, particularly in relation to children and young people.
Excellent. So, Claire, this evening we're going to look at mental health and wellbeing.
Yes.
We're going to look at some facts and figures, and also look at how we can build resilience and support for parents and for their children. There is a message system, so if you have any questions and you would like to ask us, please use the messaging system, and at the end of the presentation Claire will provide an opportunity for you to for us to answer your questions. So should we get on?
Yes. So we'll move straight on. So we're now moving over to the presentation, which you will see full screen. And we're going to look at 4 areas. We're going to cover 4 topics this evening. The first is what is mental health and wellbeing. So we'll look at some definitions. We'll look at some facts and figures around mental health, some statistics. Then we will focus on the really important area of how we can build resilience. How can we support our children and young people to have strong and good mental health and wellbeing. And then we will look at some of the support that's out there for parents and children and some of the signposting. So we're going to cover those 4 sections.
Excellent.
Okay, so we'll move on to the first question, which is what is mental health and wellbeing? And we've got a definition for that. So this is a definition by Lynn Friedley that was written in 2004, and it just shows that mental health influences us in many ways. It affects how we think, how we feel, how we communicate and how we understand. So all of us have mental health and it affects all of us every day. It's very similar. We all have physical health, we all have mental health. It affects our relationships, and it's about our ability to bounce back from adversity. It's about our ability to cope with things. Okay. We've got some clear statements around mental health as well. So we all have mental health, as I mentioned. So, you know, children, young people, and as adults, it's all something we have to take notice of. Anyone can have problems with their mental health as well, and that can range from experiencing stress, anxiety, depression, for example, to more severe mental health problems like schizophrenia and bipolar, so more severe and enduring mental health problems.
Sure.
A couple of other facts. So our mental health changes and fluctuates all of the time, similar to our physical health. Sometimes we're in better mental health than other days. We don't know as much about it as our physical health, and we don't talk about it. So that's one of the key things we want to promote today, is that as a population we need to speak more about mental health to challenge that stigma that's around.
So one of those key challenges is actually to encourage you to talk more about it, to talk to professionals and to also be aware and to talk to your children.
Yeah, to just have a general, you know, asking your children how they are, you know, saying if we're struggling emotionally, to actually talk about that, because if we were physically unwell, we'd share that with friends.
Yeah, sure.
And we need to get used to doing that with our mental health as well. As we said at the beginning, there are things we can do to promote and protect our mental health, and we'll come on to that later on. Okay. Just going to move on to a model. Do we want to pause?
Yeah, do you want to pause?
Okay. Just going to move on to a model of mental health, which is the stress bucket. So this is a really useful model for explaining how stress can actually build up and how we can actually hit a crisis point for our mental health. So we all have a bucket, and that bucket can change in size. So that's our resilience or our vulnerability. Sometimes our bucket's really big, so we can manage a large amount of stress coming in. Other times within our life it might be smaller, and you'll notice that you can't manage as much stress. So it would just be a few things that are stressful would actually tip us over the edge. The types of things that are coming into the top of that bucket in terms of stress is everything that's thrown at us in life. So you know, all the types of stresses that we've got with the family, with work, things that the children are experiencing at school, with relationships. It's all those things coming into the bucket. So you all notice yourselves that there have been points where there's been few issues of stress that are built up and you've coped with them. Sometimes it will be that one last thing that pushes you over the edge. So it might be that morning that it's been a really stressful school run, or the car won't start for you as an adult, and you feel like you can't cope anymore. It's that one thing, but the stress bucket is full and it's actually overflowing. So as I said, so your resilience and how you're coping will actually change the size of that bucket over time. But also we've got this tap at the bottom. So there is a way of actually letting out the stress. So there are lots of things we can do. Some of those helpful, some of those not so helpful, where we can release the stress. So if we've got good coping strategies like exercising, making sure we're eating well, you know, talking about our problems, we're letting the stress out before it builds up to the top.
So essentially, Claire, our vulnerability increases depending on the stress flows coming into that bucket. Is that,
yeah,
is that
so the buckets, we have a vulnerability changes in relation to our sort of protective factors and risk factors.
Sure.
So we'll come on to talk about those. So the stress changes, so the amount of stress coming in can vary, but also the size of the bucket can vary.
Sure.
And that can be different. It's very different for individuals from day to day, week to week, or month to month. The size of that bucket can change.
Sure. Yeah.
Yeah. So it's a very useful model to have an idea of how things can build up.
Excellent. So looking at sort of facts and figures next, what sort of information have you got for us this evening?
Okay, so we've got some general statistics, some national statistics on facts, and you will have heard some of these bandied around in terms of the statistics around mental illness. So at any one time, at least one person in 6 is experiencing a mental health condition. We also know that 1 in 4 people will experience mental health problems across the course of a year. And really, more importantly, and why we're focusing on children and young people today, is half of all lifetime mental health problems actually emerge before the age of 14. So it's really important to support young people, to help them to understand their mental health and well-being, and to try and make them more resilient. Okay, so we also have some general statistics why we're focusing on mental health. Mental and physical health can't be separated. So if we have a physical health problem like a cold or a long-term condition like diabetes, that has an impact on our mental health. We can't actually separate the two. The same with mental health problems. If we have a diagnosis such as depression or anxiety, that can present physically. So we have physical symptoms. So we can't really separate those two things, so one comes along with the other. Also, in terms of mental illness, it's the leading cause of sickness absence in the UK, and that's actually overtook musculoskeletal for being the main reason, and a few years ago in 2009. And that's quite striking statistic at the top there, that by 2030 there will be approximately 2 million more adults in the UK with mental health problems.
God, I'm really astounded by that. It's a really high figure, isn't it?
It is high, yes. So that's a kind of forward projection in terms of statistics. Yeah.
So that's, and what's the picture like in Cambridgeshire?
In Cambridgeshire, we have got some national data that's been applied to the local population. So we've got roughly, in the age group 17 years and under, the potential that there's 19,000 children and young people who may be experiencing problems that need mental health support, and that's at any one time. We do a survey within schools called the Health Related Behaviour Survey, and that's done in years 8 and 10 in secondary schools. And we've picked out some key statistics relating to mental health. So you can see on the screen, 7% of people said there was no adult they felt they could really trust. So that was quite a striking statistic. 21% said they'd been bullied at or near school in the last 12 months. 14% said they weren't sure, they weren't really sure whether they'd been bullied or not. And the bottom statement is the reasons why children thought they were, and young people thought they were being bullied. So because of the way they looked, their weight, how they got on in lessons, and then discriminative things in terms of their religion, their culture. So these were quite important statistics that were pulled out in terms of what our local population looks like in terms of the children, really, what they're concerned about. And we're doing lots of work at Cambridgeshire County Council at the moment related to the needs of the local population. So we're doing lots around supporting young people with their wellbeing and looking at a whole school approach within schools. So we're just moving on.
Yeah, I was going to. Yeah, absolutely. I think because those are quite startling statistics.
Yes.
And actually, I think really the next question is how can we build resilience up? Really?
Yes.
So,
so there are lots of things we can do, and this is based on kind of strong evidence in terms of what works. So we can promote and protect our mental health by doing any of the three following activities. So increasing awareness of mental health. So actually by watching this webinar, you're learning a lot more and having a better understanding and knowledge around mental health. By talking about it more and by understanding it, we're challenging that stigma. That stigma and discrimination is really large that goes along with mental illness. And we can do things to promote protective factors and reduce risk factors. We can do that with our children, with ourselves, and that makes us more resilient as well. Moving on, so we'll take each of these in turn. So in terms of increasing awareness and challenging stigma, we've got the Time to Change campaign, which I think that's something you've heard of.
Yes, yeah, no, absolutely. That was a couple of weeks ago, wasn't it?
So in February, Time to Change ran the Time to Talk campaign. So that was encouraging people to talk more about their mental health. So it was Time to Talk Day on the 4th or 5th of February, I think. And it's the idea behind that is that we talk about it more, and it's going to challenge that stigma and that discrimination. So we can do these things by finding out more about mental health, talking more about it. If someone's unwell, if they're physically unwell, we would ask how they're doing. We tend not to do that with mental health. Sure. So it's really important to say, just ask somebody, how are you doing? How are you? With your children, it's just basic questions like, how was your day? How did you get on? And if there are things they're concerned about, is there anything that's worrying you? What makes you stressed? What can we do about that? So talking about it together. And that statement at the bottom, please, is, so talking about mental health problems before they become a problem. Sure,
excellent.
Yes.
Now, I'm sure many of the people who have tuned in this evening are thinking, I want to ask a question. So please, please do type in your questions using the chat message function, and then Claire and I, towards the end of the presentation, will make sure that we answer your questions. Sorry.
Yeah, okay. That's great. Okay.
Excellent.
So we're starting to talk about resilience. Sorry, you can ask a question.
No, you carry on. Carry on.
So we're going to move on now to protective and risk factors. So we have a table on those. Really interesting things that are, again, through research, we know there's known risk factors for challenging people's mental health, and there's protective factors that we can put in place. So risk factors include, difficulty in communicating, family conflict, work stress, some of those issues there. Some of those things we can do something about, sometimes we can't. And conversely to that, it's important to look at protective factors. We'll just pick out a few. So, young people who've got good self-esteem and confidence, that can be protective. If they are able to manage stress and problem solve, again, it's a very protective factor. Physical health there, so physical fitness. So any physical activity and exercise is really beneficial for our mental well-being. It increases our mood, it releases feel-good chemicals in the body, and it can be protective but also can help us recover from mental health problems as well.
So essentially the protective factors are what make kind of things which are more positive. So actually in terms of reducing mental health issues, those are things which are positive.
They can be protective factors, so they reduce the levels of stress.
Sure.
So if you think back to the stress bucket, actually, it's reducing that stress.
Yeah.
So these are again kind of coping strategies, really, and protective factors. One that's important to note is the school achievement, and schools are looking at levels of attainment. That's great, but we need to have students who have good wellbeing and resilience in order to achieve that. So it's really important, and we're working with schools in Cambridgeshire to work towards a whole school approach, where the school is working with the teachers and the parents and the community and the pupils to work together to build that resilience within the school, and then that can lead to attainment and achievement as well.
That's fantastic, great. Please do, just to remind you, if you do have any questions, please do use the instant messenger system on the system to ask your questions. Claire, moving on,
Yes.
we're going to look a little bit more around wellbeing.
We are. So there's a model which is called the 5 ways of wellbeing, and this is a really useful way of capturing what can help us in terms of resilience and wellbeing. So it's called the 5 ways of wellbeing. It's written by the National Economics Foundation, and it's an evidence-based research background that shows that these topics, these areas, can have a beneficial effect on our resilience and wellbeing. So they are connect, be active, take notice, keep learning, and giving. And we've got some examples that are on your screen, hopefully, of each of those categories. So connecting is about making sure we're talking about our feelings. We've talked about communication quite a lot already. Socialising and keeping in touch. Those support networks that we have. So, it's children's, young people's groups of friends and their support network. Also your family and your support network as well. And that. Being active. So we talked about the benefits of physical activity. So it's benefits on the physical body, but also mental health. So taking regular exercise, walking more. So that can be getting out and about as a family, doing more activities. It can be cycling or walking to school. It's a really good opportunity as well to build that into to the day with your children. Taking notice. Again, that's taking regular breaks. We tend to, particularly as adults, we were talking about sitting at our computers.
Yes, for long periods
of time.
Yes.
So, it's recommended that we take 10 minutes out of every hour, which I know most adults don't do, away from the computer. And for young people, that's making sure that tends to be built into their day when they're at school. So they do have regular playtimes.
Yes.
But recognising that they need a break as well. And the noticing the present moment is around the idea of mindfulness, which is quite a hot topic at the moment. It's something that's in the media and people are talking about quite a lot, and that's around focusing on the present moment, being non-judgmental with ourselves, not thinking too much about what's happening, which can generate anxiety, and not thinking too much about the past, which can generate depressive thoughts.
Yeah, absolutely. So there's quite a lot of work around sort of the power of now, isn't it? So is that sort of like keeping in the present moment?
It is,
as much as possible.
Yeah, focusing on the present moment, distracting ourselves with tasks that we're doing right now. Looks that kind of immediate focus.
Great.
So one of the things that's really popular at the moment is the colouring books, the mindfulness colouring.
Yes.
So you're focusing on one particular activity. So that's a form of mindfulness.
Oh, great.
That can take us back to our childhood and help us realise how important that is for children. The kind of colouring is escapism.
Absolutely.
So the fourth category is keep learning, and this is around learning something new, joining a new group. So you can never stop learning. There's always things that you can work on and learn, which is great. And then give, the last category. There's a lot of evidence now that doing something for somebody else is really beneficial for your well-being in terms of giving you a sense of purpose, a sense of support and caring for somebody else. So even whether that's a human or pet. So cats and dogs, there's a lot of evidence to show that stroking pets can actually physically reduce your blood pressure and reduce levels of stress. So that's kind of just a few examples of those 5 categories really, but the 5 ways of wellbeing is something it's quite nice to be able to, it's an easy thing to remember.
Excellent. We're already getting some questions in around sort of mental health provision across Cambridgeshire, and that fits in really nicely with our next topic.
Yes.
So Claire, do you want to sort of perhaps update those people who have tuned in what support for parents and children there is?
Yes, I will do. So just to say that the webinar that we're talking about today is focusing on kind of wellbeing and resilience rather than mental health services. So the next section is really around what's to support children at that kind of early stage with their well-being. So we're looking at in school, there is a lot of support there for children. So you've got teachers, head teachers and teaching assistants. There's school nurses and counsellors. So if they are concerned, if they're struggling, with bullying or any other concerns, there are people within the school that
So
they can
a
go
really
to.
good starting point.
Great
is
starting
to
point.
to talk to your teacher or to teaching assistants, the school nurse, or anybody within the school
Yes.
context environment.
Yes.
Okay, thank you.
And secondly, we haven't got on the slide, I think we mentioned yesterday, that also the support of your family and friends,
Yes.
again,
Yeah.
for support in terms of that early stage. In terms of Cambridgeshire County Council services, we've got the Family Information Service, which is an online service and has a massive information about, childcare opportunities, lots of other things that are supportive within Cambridgeshire. We've got a new service called the Advice and Coordination Team, and that's for families and young people, and that will be giving advice on lots of different topics, but they will answer questions around mental health. That's being launched on the 1st of April. We're also currently working with young people to design a young people's website around mental health and wellbeing, and that's going to be a hub, a kind of central point for information. That's going to be designed by young people, but it's for young people, for teachers, parents, carers, and hopefully that will be a central point that signposts to lots of other information.
Excellent.
And then again, through the County Council work, there's parenting courses and family activities that you can get involved in.
Excellent. And some of the people, some of our audience, sorry, not people, are asking questions around counselling services and other services across the county which they can get support in.
Yes.
So somebody's asked whether there's a recommended list of therapists or counsellors.
Okay.
Yes. And there are, aren't there?
There are. So we have got some of the services on this slide, which we'll talk through, and also at the end of this webinar, you'll be able to repeat. You can watch this webinar again on a website, which we'll give you at the end. There will be some handouts and some more information on there around local services. So that's something for a follow up. So on this slide, we've got some local services that are really, really good in terms of support around mental health. So Centre 33, they do provide counselling. And I think we've got the age. Yeah, so that's for services for 13 to 25-year-olds. They have a young carers project where they support young people who are actually caring for a parent with mental illness. So it's a really good project. So Centre 33 is a great local resource, and you can actually physically go to Centre 33, look on the website or phone.
Yeah.
Euphoria, again, is information for 11 to 19-year-olds in Cambridgeshire, and that's an online resource that young people can access themselves. Top of the list is a national resource there, that's Young Minds, and that has a parent helpline, which is really, really helpful. You can actually email Young Minds or phone the helpline, and they will respond to you quite quickly with a response.
So the helpline telephone number is up on the presentation. So that's 0808 802 5544.
That's it.
Great.
Yeah. So they're very, very helpful advice over the phone. And if you do email, I've emailed recently with a couple of things that I wanted to find out about, and they returned that within a couple of days.
Sure.
That was great.
And can I just check, are these referred by the student or by the school or both?
So these are things that you can access yourself. Yeah, so you don't need to get a referral to any of these. A parent or a young person can just access these services.
Sure.
Yeah.
Great.
So
okay.
It's also important for schools and teachers to be aware of them, because actually if they've got students they're concerned about, they can recommend. They could recommend these services.
So you wouldn't necessarily for these services have to go through your doctor or GP?
No, not at all.
Great.
You can just access these.
Excellent. That's fantastic.
So we've got Stars Bereavement Service there, which is local to Cambridge. And then a few other bits and pieces on there. So Relax Kids is something that I know myself and lots of other parents use. It's a range of relaxation and meditation resources, and I have one of their books that we do some kind of short stories around meditation, and I've done those. I've got a 3-year-old and a 4-year-old and 6-year-old. She just turned 4, and we do those in the evening before bed, and it actually settles them at bedtime. And they now actually ask for those. They quite like. They said we'd like Relaxed Kids, please, because it's quite relaxing in the evening. Really, they do audio CDs, and they're actually targeted at different ages for young people. Also, there's some really good apps out there which have been designed by psychologists and developed through research around mental health and mental illness. We've picked out 2 there, which is Happify, This disrupts patterns of negative thinking and helps people manage stress. So that's one app that young people can access. And again, that's just through the App Store on their phone. So there's no reason for going through services.
Yeah.
Smiling Mind, which I really like the title. I think that sounds really nice.
It's really uplifting, isn't it?
Yeah, and that's kind of a positive app that looks at doing really easy meditation. So that's but you know, if you look for apps around wellbeing, there's lots of apps out there.
Yeah.
But these have been evidence based and developed by psychologists. And then the section at the bottom about asking your GP. So if you do find that you're concerned about your child and you have taken them to see the GP about their mental health, there are lots of options that the GP can refer to. So there are books on prescription. So libraries now do self-help books around anxiety or bullying, those types of things. There's arts on prescription, and I think this year that's being piloted for young people. So it was just for adults initially. Improving access to psychological therapies is there for adults. Exercise referral. There's also online CBT, which young people can access. There's two things, Mood Gym and Living Life to the Full. They're online cognitive behavioural therapy packages that anyone can access. They can just go online and look for those. And the voluntary sector services, which we particularly picked out, Centre 33, is supports young people. You've also got Mind in Cambridgeshire, which supports adults as well.
Excellent.
Yeah.
Okay, so I think we've answered a number of the questions that have come in through our discussions there.
Okay, that's great.
So I think please make sure that you support the young person, the child, to access these services. And if you're worried, also give them a call yourself. That seems to be some of the things coming through about is it only the child that can refer or not.
So they don't necessarily need to go through services. They don't need to go through the GP. Parents can access the services, or children, which is great.
Great, excellent. So really pick up the phone and give those services a call, really, isn't it? Yeah, excellent. Okay.
So this was just a summary of what we've covered.
Yeah, okay.
We've covered quite a lot of ground in the last 20 minutes. So we've talked about how everyone has mental health. We've looked at the statistic around half of all lifetime mental health problems develop before the age of 14, which is why we want to kind of build resilience and wellbeing in young people. The idea that prevention and early intervention is really important. It's kind of key. The earlier we get support for a mental health problem, the better the recovery. It's really important to increase your knowledge, understanding, communication. And also we've talked about how there are lots of local and national resources that we can, that you just mentioned about over the phone, online and via apps as well. Excellent.
Well, let's move on to the Q&A. We have had some questions come through. But Claire, if my child was anxious, what could I do?
So the first, there's lots of information online, but the first point is really looking at self-care. So to make sure that as a family you're kind of looking after yourself. So making sure that young person is sleeping well, eating well, maybe getting some physical activity and exercise as well, and using the support of their family and friends. So there's lots of self-care types of practical skills. Also as a parent, being kind of making sure you're listening and having those open conversations, and being non-judgmental about that as well. And then in terms of resources, there's lots of really good support online. So we've got Young Minds, which I think we mentioned already.
Earlier.
There's a really good website we came across recently called Hands On Scotland, and that has got a section on helping children flourish. So that's really an advice for kind of parents and teachers.
I like that. That sort of feels really
positive. Really positive.
Flourish,
yes,
so
yeah. And again, if you're really concerned about your child in terms of anxiety, there are services like Centre 33 who would support your child with that, possibly through counselling. There's the YMCA.
And
again,
they offer
counselling as well.
Yeah,
yes,
great.
Yeah. And I guess we just mentioned the relaxation techniques. So some of that meditation, that calming stuff that you can do at home as well.
Really effective, isn't it? Excellent. I think if one of our viewers' children or their child was being bullied, I think this is quite a common concern from parents and carers and guardians. how could I look after them?
Yeah, so again, it's around kind of that non-judgmental support as a parent, asking them what's worrying them, having that open communication, and asking them how they would like you to approach it, really. It might be about talking to friends or their peer groups, or maybe contacting the school. And again, the self-care around maintaining their well-being. So if they're starting to develop symptoms like anxiety or other things because of the bullying, it's making sure they're looking after themselves, you're looking after them at home. Again, Euphoria has got some really useful information. So if the young person wants to look at the information online themselves, Euphoria is really helpful. It's local to Cambridge. And there's a whole section on bullying actually on Young Minds. So there's a section for parents and a section for young people.
Oh, that's excellent.
Really
So
good,
lots
really
of
good.
really good sites there, and advice and guidance.
Yeah.
I quite often get sort of parents saying to me at college, so I'm sure this is the same within the primary school and secondary system, that usually my daughter, or who might be 16, for example, just isn't communicating with me.
Okay.
And the parents say, is there something wrong with her?
Okay.
What would you respond to that?
Yeah. So obviously it's really common among that teenage age group for communication to change. And it can actually be really difficult with that age group to recognise symptoms of mental health problems, because they're very similar, with the withdrawing that you get in those teenage years. So it's about trying to keep that communication open, but also to be aware of those resources that if your child doesn't want to speak to you, there's resources they can access out there. So there's the self-help books in the libraries. There's also Euphoria and the Young Mind that they can access themselves. So I think Young Mind's target age was around 11 to 19, so that kind of challenging age. And there's lots of chats and troubleshooting things on Euphoria.
Great. So a really useful website, Euphoria, isn't it?
Yes.
So excellent.
I'm just move that slide along.
Yeah.
We've got some of those.
Absolutely. And here
there.
we've got some of the agencies and their sort of
their logos.
their logos. So please do have a look at those as well. I think, are we having any other questions in? No, not at the moment. What about self-harm? So if somebody thought their daughter or their son might be self-harming, what could they do?
Yeah, so it's really important with self-harm to realise, to have a little bit more understanding of it, so parents can go online to find out more about it. But it's actually, it's not a diagnosable condition in itself, it's actually an expression of distress. And it's a way of coping. So often there's an underlying emotional difficulty, and they can be quite worried about things. So again, it's really important to be non-judgmental, and often people are doing that because they're quite distressed. It's not due to attention-seeking behaviour. There are lots of support services out there again. So the Royal College of Psychiatrists has got lots of information around self-harm. Pinpoint in Cambridgeshire has got a parent support group on self-harm. So that's somewhere that you can find out really useful information at the moment as a parent.
So for parents who are concerned, they could look at Pinpoint, who have a website and access information.
If you're, I mean, if you have really concerns about the kind of severity of the self-harm, it's possibly important to contact services. So that would be taking them to the GP if you're concerned. Or if you're in an emergency situation, you're concerned about the level of self-harm, it's actually taking them to accident emergency. Someone's just posted a question linked to self-harm, but if they have a disability or a learning difficulty, is there any advice and guidance? So I think the advice and guidance is very similar, but it would be based on supporting someone depending on the nature of their learning disability. So making sure you're communicating with them at a level that they can understand. And self-harm can be quite common among people who have a learning disability. But again, it's making sure that you're not kind of putting it down to the learning disability. There might be an underlying emotional cause for that for that self-harm.
Excellent. Okay. Let's ask one more question. If that's okay, Claire. My child gets really angry when things don't go right. And I don't think it's healthy. Are there ways I can help him or her to deal with it better and be happier? Lots of questions in there.
There
are actually, aren't there? That's a big one.
That's fine. So again, it's having that open communication and trying to find out why they are angry, because sometimes young people don't know why they're angry. So kind of exploring that with them. the Hands-On Scotland has got some practical steps actually for dealing with anger in your child. So I think that website is particularly useful for any issues around anger. And again, a lot of the support agencies we've mentioned, Young Minds, and the stuff online, but also the self-help stuff in the library books. They have stuff on anger, and again, it's possibly the self-help things at home, so help making sure that they're looking after themselves with the exercise, eating, sleeping, but also maybe finding another way of letting the frustration out, so physical activity or running around, so kind of alternative behaviours as well.
Excellent. Well, thank you, Claire. Okay, well, I think there aren't any further questions.
Okay.
We've had somebody thank us for putting on the webinar, so that's great,
That's
isn't
lovely.
it? And we would like
very
to thank you for tuning in to this evening's webinar on mental health and wellbeing. Claire, can I take this opportunity to thank you?
Thank you very much.
For a really informative 35 minutes.
That's been great.
Is there anything else that viewers can do if they want to access this information?
Yes, so
further?
on this last slide we've got a link at the bottom there for Cambridgeshire Insight, and we will be posting this webinar, the recording of this webinar, on that site in the next week or so.
Okay.
And there'll be we'll be putting some of the question and answers on there as well, so that will be on there, and some of the agencies that we've talked about. There'll be a list of those.
Excellent.
That's brilliant.
That's great. Well, thank you everyone for tuning in. It's been an absolute pleasure. Claire Harris, thank you very much
Thank
as
you
well.
very much.
And
Thank
it's
you.
been great. Thank you.
Thank you.